Are you ready to purchase or refinance a home? With over 20 years of experience in the banking and finance industry, Andy Pfaffl is more than ready to tackle any concerns you might face during the finance process. He pays for every appraisal, charges one simple fee, and he makes himself available to his clients 24/7, 365.
Call Andy today for a free consultation and experience for yourself the network funding difference of integrity, reliability, and simplicity. Hey, everybody. Thank you for joining our podcast, Moms on the Move. I'm Jen Wells.
And I'm Ashley Steigerwald.
We are here with Dr. Andrew White.
Hi, all.
Hey.
Good morning.
Thanks for coming, even though I told you the wrong time.
Oh, it's
Thanks
fine.
for coming back.
I always have things to fill my time with. It's okay.
So you are with Parkside OB.
That's right.
You
Yep.
are my OB.
Yes.
Aw, it's a little awkward.
No, it's not.
Not for me.
No.
It's never awkward for me, ever.
So you delivered Bo
Yep.
because your practice just started. What, like
We're
3
actually
years?
starting our fourth year.
Fourth year.
In July.
Okay.
Isn't that crazy?
Yeah.
Parkside's like taken over.
Yeah.
Yeah.
It's like pediatrics, the lactation center, the
Yeah,
Brio
yeah.
now. I
Mhm.
mean, it's the whole shebang.
The crazy thing is that they've never tried to grow. They've
Wow,
just
interesting.
Yeah. I think when you provide good care and you
Mhm.
care about people, they demand that you grow.
Yeah.
And so Justin Mull, who's one of the doctors at Parkside Peds, will talk about like how do we grow smaller while we grow bigger.
Mm-hmm.
And I think there's always going to be people who feel the growth and are dissatisfied with the growth.
Yeah.
But at the same time, like otherwise you're closing your door to people and you want people to have the doctor that they feel most comfortable with and the experience they feel most comfortable with. So
Mm-hmm.
we've grown a lot as a company, but it's never been the plan. It's just
Right.
been in response to demand.
Yeah.
Yeah.
So yeah, with both other boys, I delivered somewhere else, and then one of my friends went to Parkside, and they're like, "You have to." Not that I was dissatisfied with the other, but I wasn't
Yeah.
like, "Oh wow." So you were the only doctor I hadn't met with before.
Oh, I didn't remember that.
Yeah.
Before the delivery?
For delivery. So we had just
Surprise!
met in the delivery room.
Wow.
Yeah.
That is crazy to me. I feel like I know your husband so well, but I guess that's just
Because we went through a trauma.
Yeah, exactly.
So like, you know, your third, I guess we should preface this whole conversation with like, we're going to try our best to be professional, but
It's real life, though.
It's real life.
It's real life.
Yeah.
And real life mom stuff.
Yeah.
Yeah.
So we
yeah.
can't be ashamed of it. This
It's
is
the
what
stuff of
happens.
life, actually.
is.
It
Yes.
is.
Yeah.
Yeah.
So
If you're planning on having children, don't listen to this episode because I think Jen and I are about to totally freak you out.
But this normally doesn't happen.
right.
It's very rare.
Well, like,
Yeah.
So Bennett and Braden. Bennett, my first, was this easy breezy delivery. Everything was great.
Which nobody says that about their first.
Ever.
Yeah.
No. Second, I had to get induced. And then Bo, the third. I went to the hospital. They're like, yeah, you're contracting, but you can't come in. I was like, oh, this is cool. So then that went on for a while. In that week period before I actually was able to get induced, Chris decided, oh, I'm going to have an anxiety attack this week.
Okay.
Okay.
Perfect timing.
Perfect timing.
Let's make it about him.
Yeah.
Yeah.
I was about to say.
So he had an anxiety attack.
Oh.
He didn't sleep for a solid 4 days, and then he got a face infection, okay?
A
While
face
I'm about
infection?
to have a baby.
What is a face infection?
I don't know.
Like erysipelas? Like,
don't-
you
yeah,
know,
something.
It was
something from the
serious. He had to go
1800s?
get an IV antibiotic.
Oh, my word.
Like it was serious. So then the doctor gave him something to sleep, which was the night that
Of
I
course.
had to go in and get induced.
As
so
it happens.
there's
Yeah.
Chris sprawled out on the couch. Can't even move him because they come to do my epidural and they're like, ma'am, he's not allowed to be back there. I guess there's a protocol of where
Yeah.
you can stand.
Right.
And we couldn't get him up. Okay. So I was like, oh, this is great.
Yeah,
Great.
perfect.
Let's make this all about you while I'm
Right.
here,
Right.
in pain.
Yeah. Bearing
then-
his child. Yeah.
His third child.
Right.
So that's all happening. And then finally, Bo's ready to come.
hmm
Do you remember what happened?
God, I can't remember. I remember the end of the story. I don't remember.
He said, there's a hand.
Oh,
Do you remember
yeah,
that?
yeah. A hand, it's called a compound presentation. Yeah,
I was like, oh, that's funny.
yeah.
You're like, it's not funny.
It's not good.
It's not. And I was like, oh, that's not funny. That's
Yeah.
not funny at all.
Yeah.
So that happened. And then then Beau was born, everything. And then 8 days later, it was,
Mhm.
I had a postpartum, what do you call it, a secondary hemorrhage?
Delayed, or
Yeah.
secondary postpartum hemorrhage. Yeah.
So that was like just very traumatic.
Yeah.
Yeah. So then you were there to do, I came into the office. I shouldn't have come into the office.
Should have gone to the emergency
It was good
room.
that you came somewhere.
Yeah.
You needed to be seen.
Yeah. So I came into the office. I was very like nervous.
And to be honest, you probably got quicker care because you
Yeah.
came into the
Yeah,
office. We
because
got
I
to skip
fainted.
the emergency department. Yeah.
Yeah. So he tried to do like a DNC. I ended up fainting and then got transported in an ambulance over to the hospital.
I drove
Or-
behind the ambulance.
Oh.
Yeah.
But then I see him at the hospital and I was like, thank you for coming. And he's
I don't
like,
think she knew that I was a surgeon.
he goes, I'm doing your
Yeah.
surgery. And I was like, oh, I thought you were here to be my friend.
Yeah, I'm just here to hold your hand. I'm going to call another gynecologist to do what I can do.
That's how out of it I was. So anyway, we survived that one together.
Yeah. Yeah.
And then you came in and I had lost like so much blood. You were like, your hemoglobin's at, it was like a
6 or
six.
7. Yeah.
I was like,
Wow.
is that good?
No.
He's like, no.
Nope. That's like half your blood gone.
Half your blood, yeah. So anyway, yeah, it was a fun time. Women go through it.
Yay,
Yeah.
babies. Have babies.
Yeah.
Yay, babies.
I can probably count on one hand the number of times in the last 8 years that I've had that happen.
Wow.
Yeah.
Yeah.
It was so
And
crazy.
as much as you bled was especially rare.
Yeah,
So
right.
hope that's okay to say.
Oh, yeah.
I'm very aware of like, this is your story. I am bound by HIPAA. You are not. So
Yeah, no,
I
it
hadn't
was
thought about
worried
that,
of
like,
incriminating
yeah,
myself on
exactly.
air.
No, you're allowed to say anything. It's all right.
Great.
Yeah, so then Beau was so little, so I didn't
Mhm.
want him to come to the hospital and
Right.
stay there. So he stayed, and I had Chris stay at home to be with Beau. And so my sister came, who can also not stand the sight of blood. So let's make it about someone else again. So
Right.
she had to sleep next to like this like bag.
Yeah. Yeah.
So she
We had a bag draining.
Mhm.
Yeah.
So she had to crawl to the bathroom because she was going to faint and throw up.
Oh, my word.
So I had to call the nurse.
I did
in.
not know that story.
Yeah, and then it was one of those like, it's not about you.
Right.
Like, dear Chris, dear Amy.
Aw.
The only time that it was actually about you is when you were under general anesthesia.
Yeah.
Like
Yeah.
everything else.
Oh my gosh, that was.
So all done with babies?
Oh dear God. Yeah.
Let's not do that again.
Let's never do that again. Never.
Is
was
that something
such-
you could have other children afterward, or is it become?
Yeah.
Okay.
Yeah. You can normally recover without any complications from something like that.
Yeah.
There are rare complications,
Mhm.
but usually you would know about those because typically you stop having periods if you have really bad complications from a DNC.
Wow.
Okay.
And that can result in infertility. But that is like, super duper rare.
Yeah.
Yeah.
Now, after a hemorrhage, you're more likely to have another hemorrhage.
Right.
So,
Let's not
yeah,
do that again.
let's not do that again.
I had C-section all three. All three
Yeah.
were C-section. The first one, Brigham and Women's up in Boston, and fabulous
Yeah.
guy. They took care of me there, but same in labor, 24 hours, pushing. He was not coming out.
It
Mhm.
wasn't scheduled. It was.
Oh no, it was traumatic.
Yeah.
It was just, and then heart rate started dropping. They're like, "Yep, we're going in for the C-section." So it was like recovering from both after that
Mhm.
one. But
Yeah.
in the other two, they're like, "Do you want to try it again?" And I was like, "Nope. We're gonna schedule this. It's gonna be at 8:00 in the morning. I'm gonna come full makeup. Like it's gonna be like a whole
Yeah.
scheduled thing." And I know a lot of people have a tough time after C-sections, but mine, it was like have the C-section like 4 or 5 hours later. I'm like, I'm gonna go get a cup of water, walking around.
Oh
I
my gosh.
bounced back after the C-sections like that.
Yeah.
So,
That's crazy.
I know. The human body. But yeah, but I also have babe. My first one was 10, and then 9 pounds, 9 pounds.
You know how to grow them.
I do.
I have little
Big
tiny
boys.
ones.
Big boys.
Or like then it was 5'12".
So, do you have all boys?
Yes.
And you,
Yep.
wow, okay.
But mine are older. I have 15.
Okay.
I have one turning 9 today.
Wow.
Happy birthday. And
Yeah.
then an 11-year-old. So opposite end of the spectrum of it.
So obviously, like now they've gotten more aware of postpartum.
Oh,
Postpartum
for
depression.
sure.
Depression.
The 4th trimester, we call it, in fact.
Ah.
Okay.
Yeah.
Interesting. Because when I had Bennett, you didn't do that checklist, anything like that.
Mhm.
And now you go in, and they usually do it at the pediatricians, and also 2
Yeah.
different times. With the-
We do a 2 and a 6-week postpartum visit, which I think is actually something unique for our
Yes.
office. Because I think most
didn't
other
have that
offices
before.
just do a 6-week.
Mhm.
Unfortunately, insurance doesn't pay for 2 postpartum
Mhm.
visits, but you need to be seen at 6 weeks to make sure that you're fully recovered. But you also, like, I can't imagine being at home with a newborn baby for 6 weeks feeling depressed. And a lot of people don't want to make a phone call and bother their OB-GYN,
Yeah.
bother. It doesn't bother us,
But
but
they feel like
they feel
are.
like it does.
Yeah.
And so out of a desire to catch postpartum blues and depression sooner, we've implemented a 2-week postpartum visit,
Yeah.
which is in line with what the American College of OB-GYNs says to do now. Unfortunately, insurance companies haven't caught up to that. So practices that choose to do that choose to lose money
Right.
on those spots that you could have
Wow.
otherwise seen patients you would have gotten paid for.
Okay.
But I think what's the downstream cost of not catching depression
Mhm.
and trauma to both the mom for being depressed, but also the baby for not saying that, depressed mothers can still be great mothers, but
Mhm.
I'm sure that we're not all being as strong and helpful as we can be if we're struggling with
No.
depression at
Yeah.
the same time as raising
Yeah.
a new baby.
Because I came in and you guys put me on Lexapro.
Mm-hmm.
Thank God.
Dr. Klein always says, Jesus loves me, this I know, for he gave me Lexapro.
Yeah. So I actually recently, I'm just telling everyone all my stuff. I just went off of it
Yeah.
like a month ago.
Yeah.
And I think that Lexapro had hindered my crying because
Okay.
I didn't cry for almost a year, I feel like. And then,
Wow.
I
I
know.
cry every day.
are you on Lexapro?
No, I'm on Wellbutrin.
Oh, that's why.
Yeah.
So we had Bennett's graduation the other night, and I was like, I saw the little graduation field. So it's been so different. And
Are you a crier?
No.
Wow. Okay. I definitely cry more than both of you combined. I don't feel like it's a day if I haven't cried.
My husband, sorry, Bill. My husband's a weeper.
Yeah.
Yeah, he's very sensitive and
He's a two.
yeah, he things
He's a
get to
two?
him.
Enneagram.
Oh.
Oh.
Yeah. Do you know what I am?
What?
Sorry, I interrupted you.
No, go. You go. I'm
No,
curious.
I want you
now.
to guess. I want you to
Oh,
guess what
I
my
do.
number
Okay,
is.
I do. Hold on.
What's the helper? Is that 9?
No, the helper's 2.
2. Okay.
Yeah.
You're a helper.
No.
No.
What are you?
An 8?
No, I'm not an
No.
8.
I'm an
9.
Oh my, are you really an 8?
Yes, she is. A monster.
That is shocking to me.
Is it?
Yeah.
Yeah.
Okay,
are
so
you?
I'm a 4.
What's that one?
The romantic individualist.
Oh,
Yeah.
yes.
Yeah. There are very few 4s that are doctors.
That's so funny.
Yeah.
That's why you're the favorite.
Well,
Well,
I am drawn, 4s can go to 2, especially in
Mhm.
stress. And so I can become very clingy and needy, like an unhealthy 2 when I'm stressed.
yeah.
But my greatest desire in life is to feel unique and special.
Yeah.
And 4s, they constantly believe that there's something broken inside of them that makes them different from everybody else. I know, isn't that so horrible and sad?
Yeah.
But I think
It's better than
That-
an 8.
the great thing about being a 4 is that everybody feels that to some degree.
Yeah.
Yeah.
And so you can see how
empathy.
they feel broken
Mhm.
as well. And it's very easy for me to identify someone's fears and shame and anxiety because I'm very familiar with mine. And so
That's really good, though,
I think
being
it helps
in
me
your
connect.
position.
Yeah.
Did you have a tough childhood?
Oh. Ooh.
Okay. No.
I have parents that love me very much.
Thank you.
I would not describe my childhood as easy.
Okay.
Yeah.
Okay.
Um,
I'm a 3-wing 4, so when
Oh,
I hear
are you really?
Yeah.
We did
Yeah.
a whole episode on this.
I mean, my favorite conversation is to talk about our childhood traumas. If I can have a conversation about your childhood trauma, I feel connected to you as a person. But, I think that being a 4 helps me in my field, especially because we're the most emotional of all the numbers,
Mhm.
I think most people would say. And we're also very comfort in sadness and in joy. We vacillate between the two, and we almost are never in the middle. We're always either super happy or super sad. But it really helps me walk out of a patient's room who just had a miscarriage, and I'm able to be in that moment with them and feel
Mhm.
that pain with them. And then to go into another room of a 39-week mom or a postpartum visit and
Mhm.
everything's great and happy, and to become just as happy for them as I was sad for the last patient.
Right.
which I think is a very draining thing for most people.
I was about to say, are you able to turn it off at the end of the day? Because I think that's...
Well, it doesn't drain me. That's the thing about being a 4
so
that I think is different.
It brings you the
I
energy.
don't get drained by my emotions.
Okay.
I like feel alive because of them.
Wow.
Yeah.
I don't have emotions.
You will now.
I will.
At least not that you're willing to tell anybody about.
So true.
Oh my God.
True. Very true.
Oh, he read you. He
I
read you.
know. It gets me.
4s and 8s actually they can jive pretty well together, I think, because we both are very intense personality types, and we can appreciate our brutal honesty.
Mm-hmm.
We're both very willing to be brutally honest.
Mhm. Yeah. So you just mentioned miscarriage.
Yeah.
I have so many friends, my sister.
Yeah.
And how common is it?
Yeah. So of all pregnancies, meaning a sperm met an egg and they started dividing, creating a unique individual human, about 60% of those are lost and miscarriage.
Wow.
Most of those are never diagnosed as a pregnancy.
Okay.
And I really recommend against people taking a pregnancy test before they've missed their period, because you will start finding positives and then you will have your period. And if you're really wanting to be pregnant, that can be so devastating.
Okay.
So I really recommend waiting until
nice.
you have missed your period before taking a pregnancy test.
Okay.
But of clinically diagnosed pregnancies, and what I mean by that, pregnancies that are diagnosed either radiologically or histologically. So pregnancies that we see on an ultrasound and can say, yes, this is a pregnancy in the uterus, or pregnancies that someone comes into the office, they miscarry, we send whatever they miscarried to a pathologist, and the pathologist looks at it under the microscope and says, yes, this was an intrauterine pregnancy.
Yeah.
About 10% of all pregnancies are lost.
Wow, that's a lot.
I would say, of women who have been pregnant, I think it's more common to have had a miscarriage than to have not had a miscarriage.
I think of my friends, I feel that way too.
And a lot of your friends haven't told you about their miscarriages.
Right. I think there's still, it's funny because I was on the phone this morning and one of my friends, she had 2. She said, as far as we've come, there's still a little bit of a stigma and like a shame associated with it. And she's like, whether it's, you don't want to tell someone what you just went through, and it's like, you don't want to upset someone else too because people aren't talking about it.
You don't want to be a burden in some ways.
Yeah. But it's traumatic. And then I think also people are like, did I do something?
I was about to say that. And I do want to be very careful not to mansplain things.
Yeah.
Because I realize that I have never experienced these firsthand as a woman. I have walked through this valley with lots of women. So what I'm saying is secondhand and what I've been told. But, I find that a lot of people have a hard time believing they didn't cause it. And that there wasn't something they could have done to have prevented it. And unless you're out there smoking crack,
right,
there's almost always nothing that you could have done to have changed that in the first trimester. And unfortunately, there's almost always nothing we could have done to have changed it in the first trimester either. You really only start getting into preventable pregnancy loss in the second trimester.
Okay.
So those, 14 and under losses tend to be just
your body.
It was always going to have happened. And most of it is what we call aneuploidy, so abnormal chromosomes. So things like Down syndrome cause miscarriage. Most babies who don't have a normal set of chromosomes get miscarried.
Okay.
So, and that makes up the majority of the loss.
Right. The over 35 group.
We worry way too much about that.
Well, there has to be a reason. What's the reason that it's just
There's got to be a cutoff somewhere.
It's a line.
I feel like there has to be a line somewhere.
But the line moved up.
It's a line in the
sand. 37, right?
As long as I've known it, it's 35.
Yeah. Really?
Yeah.
Now, if you're having triplets, it's 27.
My cousin had.
So if you're having triplets and you're over 27, you're like a geriatric pregnancy.
Yeah, that's what they would consider.
We need a new word. Can we?
I know.
Yeah.
No more geriatric pregnancy talk.
Let's call everybody else like young.
Yeah.
And then just the 35 plus going to be normal.
Yeah.
Adult pregnant
No
patient.
longer a spring chicken.
Right.
Yeah.
There's nothing magical that happens at 35,
Okay.
but the incidence of aneuploidy, so again, that rare condition where the chromosomes are not all normal. And I hesitate saying that because I think people with aneuploidy are often the best versions of humans.
Mm-hmm.
Yeah, and I
Yeah.
wanted to back up onto that and say, that is the body's natural response. We're not suggesting that should be anybody's preferred method if you find out you have a child with a
Right.
chromosomal abnormality, because they can have wonderful, full, beautiful
They're the
lives.
best of us.
Exactly.
Yeah. And they're hard. I'm not saying they're not hard. I don't want to invalidate. Is it invalidate? It's invalidate.
I like it.
Invalidate.
Yeah.
Someone's experience.
Yeah.
It's hard. I'm not saying it's not. But so anyway, I think that as far as the pregnancy loss issue with aneuploidy, it's far more common than we've ever imagined it to be in our minds, and we tend to think that it's our fault, that we shouldn't have done this exercise, or we shouldn't have had that drink at the bar that before we knew we were pregnant, or I shouldn't have gotten the jacuzzi, and it's almost never that.
Right. Yeah, I feel like that's really important to hear because I know it's a lot of that like blame, inner blame. And then I think, a lot of my friends I actually texted and said you were coming on, and I was like, if you have any questions, it was like one after the other. I was like, whoa, girls, let's calm down.
Wow. Okay.
Yeah. So one of the questions, which I thought was great, breast cancer. It's becoming more common under 40.
Yeah.
So, should we be more proactive with mammograms?
Yeah.
Starting at a certain age.
Yeah. Backing up, I forgot to answer the whole 35 thing.
Oh,
One
yeah.
second. The risk of aneuploidy of the abnormal chromosome is about 1 in 365, and the risk of Down syndrome is about 1 in. The risk of aneuploidy is about 1 in. No, I'm sorry. Backing that up. Saying this right. The risk of Down syndrome is about 1 in 365, and the risk of any chromosomal abnormality is about 1 in 180.
Okay.
And so we use that as the line in the sand to say that, your risk of having a baby does increase every single year, and 35 is the number we've chosen to say, you're now considered high risk, because there has to be some line in the sand.
Okay.
But if you're thinking about those numbers, that's still way less than 1%, right?
Yeah. So it's not like there's a certain age where people should start saying oh my gosh.
Talk.
Yeah. I mean, is it more from a fertility perspective?
I think that if you're having normal periods and you're in your 30s, especially less than 35, you probably don't need to do anything about that. But if you're having irregular periods or you're having trouble getting pregnant, we can do something called ovarian reserve testing to see how many eggs you have left. And that can be a marker of your fertility. But, it's not something I would recommend that somebody go get drawn if they have normal monthly periods and they're 32 and they haven't found that right person yet. It's just, we can do it if you really want to know it. I'm not saying insurance is going to cover it necessarily.
Right.
But it is an option for people who are concerned about their fertility.
So fertility, it's not,
Yeah.
I feel like that's important. So it's more of a fertility issue, not something that could go wrong.
It's both.
It's both. Not as dramatic.
Yeah. The number where things really start getting high risk is 40.
40. Okay.
Yeah. But your body can be different. Some people have the fertility of a 40-year-old at 36, and some people have the fertility of a 36-year-old at 40. And so it's hard to say without knowing somebody's history, and definitely is a conversation you should have with your OB-GYN.
Right.
If you're interested.
Well, she is.
Yeah. I'm saying that to the universal you, the royal you.
The royal you.
But as far as breast cancer goes, certainly if you have any first-degree relatives, so that would be parent, sibling, or child with a history of breast cancer, or any history of a male family member who had breast cancer, you should definitely talk about early screening. The American College of OB-GYNs, I'm just going to call it ACOG since I've said it for a couple of times, is our kind of governing and guideline body. And they say that you can start having screening mammograms as young as 30. And that's a shared decision-making model with your OB-GYN based off of your risk.
Okay. Okay.
So, and you know, I think that it's very important for people to go every year to their OB-GYN for a breast and a pelvic exam.
Mm-hmm.
So we don't catch all breast cancers that way, but we catch a lot of them
Yeah.
through a breast exam.
And is
Right.
it every 2 years for a pap smear now? So you're saying every year, but I was told at one point it was like every 2.
So pap and pelvic exams
Separate.
are not the
Okay.
same thing necessarily. So you have to do a pelvic to do a pap.
Yeah.
But so I would still say that you should see your OB-GYN every year for a pelvic and a breast exam, even if you don't need a pap.
Okay.
And those guidelines are in the middle of changing again. They've changed a lot over the last several years. What it is now is if you're over 30 or older, and you've had a negative pap smear and negative HPV testing, you actually don't need a repeat for 5 years.
Wow.
Which is really scary to women who've been doing it every year.
Yeah.
Yeah.
And then if you're older, you say we don't start papping until papping. Is that a verb? We don't start screening for cervical cancer, which is why we do the pap smear, until 21. And it used to be when you became sexually active, but it's not that anymore. So we don't start screening until 21. And then if your pap smear is negative, we don't typically test for HPV at that young of an age. It's every 3 years.
Mm-hmm.
And the reason being, it takes HPV, which is the virus that causes cervical cancer, 8 years to cause cancer.
Oh, wow.
So, and the body clears about 80 to 90% of all HPV within 18 to 24 months.
Mm-hmm.
So there's a lot of HPV that if you're testing every single year for, you're going to find the HPV or the abnormal pap smear created by the HPV. Then you're going to do a biopsy. You're going to get an abnormal biopsy result, and then we're going to take off a part of your cervix to treat it and get it, get rid of it. And
Versus
then you're
letting the body naturally.
and then you're at increased risk for a preterm birth because you had a cervical procedure. And so we're creating preterm birth by screening too frequently in a woman who would have otherwise cleared the infection in the next 2 years. Yeah.
Very interesting.
But I understand. I mean, I take care of a lot of women who that's just inconceivable to not screen for cervical cancer every single year.
Yeah, I mean, that makes me a little nervous.
Yeah. But you have to go back to, it's 8 years. It takes,
Right.
I
So.
haven't been in years.
You haven't been in years?
Mm-mm.
Since, like, what? You gave birth?
Probably like a year after that, and he just turned 9 today.
This is like my keeping a
I'm
straight
sorry.
face.
I know.
You're dying
I'm like,
inside.
I know.
Wow.
I know. I need to.
You need to go papping.
I need to
You
go
need to go
papping.
pap.
I need to
Yeah.
go pap. I know.
Yeah.
Yeah.
I know. And I also need to go to the dentist, and I need
So
to get my
many things.
finances in order. This podcast is just, I know.
All the things you need to do. So, obviously, I was in to see you
Yes.
recently.
Yeah.
And we talked about, what is it called? Endometriosis?
Adenomyosis.
Yeah, I can't say that right. So that, and I wanted to talk more about like endometriosis because that's pretty common, isn't it?
Yeah. Yeah. The exact number of women with endometriosis is escaping my head right now.
Yeah.
But it's way more common than people think.
Mm-hmm.
And it can vary in severity from just, my periods hurt and they're a little heavier than most, all the way to, severe debilitating pain that can keep you in bed for days and, bleeding that can cause blood transfusions.
Wow.
So, yeah, it's a disease with
really
a wide
varies.
spectrum.
Okay.
Mhm.
And same with PCOS. I feel like that's become
I think that's 12%. That's the number I'm keeping in my head.
PCOS.
PCOS is 12% of the population.
Yeah, which is polycystic ovarian syndrome. So I feel like that has gotten a lot more. And I think social media has helped with that, bring awareness of PCOS. I have a family member, I don't want to put her on blast, who's for years been dealing with it. So, yeah.
I have a friend who's dealing with that. I actually had that before Bennett was
PCOS.
born. Yeah.
Yeah.
I feel like I'm a mess.
You're very normal.
Really?
Yeah.
Yeah.
And I think that's one of the things that's just people are becoming more comfortable talking about
Yes.
their issues. And so we're hearing about it more. And it may not even be that the prevalence has increased as much as it's just
Talked about.
the ability to hear it in the normal conversation has increased.
Yeah. That's a good thing.
Yeah.
No,
Oh,
it's a
yeah.
very
Yeah,
good thing.
it
is.
We were talking about before the show about using proper names, like with kids and stuff, teaching them the proper names of their body parts and not being afraid to use words like penis and vagina because they
Right.
are scientific terms. And like you were talking about, God forbid the child is sexually abused, they need to have that vocabulary.
Right. Exactly.
Yeah.
Yeah. It needs to be more than somebody touched my bottom.
Yeah.
It needs to
Mhm.
be somebody touched my vagina.
Yeah.
And as no parent, it's hard to even have that conversation as a parent of like, hey, honey, we need to start using anatomic terms.
Mhm. So the other night, Braden asked me how he came out of my stomach. I just was like, you want a snack?
How old is he?
He's 4. He's gonna be 5. So I don't know.
Yeah.
Like, what?
I'm a fan of
just
accurate,
honestly.
short.
I have a
accurate and
shout
short.
out to girlology
Okay.
and guyology.
Okay.
I worked with Melissa Holmes, who's one of the founders of Girlology, for years. And she actually did like a Greenville TED Talk about like when to have the sex talk. And she said
Oh.
8 is great, is what
8
she
is
said.
great.
8 is great.
Okay.
But those resources are amazing. And
She needs to come on.
yeah, you need to have, I mean, she's a big deal. It might be hard to get her on.
Oh, okay.
But I mean, it's like a
See if you
nation.
can
It's
pull
a
some-
Yeah.
nationwide
Really? Yes.
thing.
Okay.
Yeah, but girlology and guyology are both very just. It's sexual health in a just completely non-judgmental. Like nobody is like assigning morality to anything. It's
Mhm.
just like this is your body part. This is what happens with it. This is to be expected as you enter puberty, and yeah, it's great.
That's actually
Yeah.
But I think at 4 you can start using correct terms.
Oh yeah, for
We do.
sure.
Yeah, like this
You
is the
never-
term, and yeah,
It's never too early to use the right terms.
Yeah.
They named it something else though. Like I don't even.
Yeah.
I always correct them. I'm like, this is
yeah.
like your balls don't itch, your
Yeah.
scrotum and testicles. Like,
Yeah.
just
Yeah.
I just.
Let's just call it what it is.
I know, I just it's one of my pet peeves. I think I just
Mhm.
use it, and same. I'm at 9, 11, and 15, so we've had
Yes.
lots of different talks
Oh
about
wow,
this.
yeah. Not looking forward to those ages.
No,
Me
it's-
either.
Yeah.
But when they have those questions, like they're 8 and 9, we'll be in the car and they'll ask random things sometimes, and they're all boys, so sometimes they'll say it just to get the reaction out of the other ones.
Sure.
Mhm.
That never changes.
Exactly.
Yeah.
So Bill tends to be like, "Oh my God, I'm not answering that question," and I'm just like, "No, this is this," and then. If you make it not fun, it's not fun anymore. Like, because they just know
True.
mom's going to give them a scientific answer and they're not going to get the reaction.
Right. Yeah.
Because it's not as fun
Yeah.
anymore. Because you're going to have to listen to mom say penis and vagina.
And
like
nobody
15.
wants- nobody
and
wants
nobody
that.
wants that.
Nobody
so
wants
then they
that.
shut it down because
Yeah.
they know I'm just going to give it to them.
That's fine.
Yeah.
Yeah.
Great.
Yeah. But some of the stuff they ask sometimes, like, you're just like, wow, where did that
Come from.
random stuff in the car? Like, the other day, one of them was like, Mom, like, yeah, we're driving and Bill's in the car too. It's like, when a guy becomes gay, does he wake up with a vagina?
Wow.
And I was like, no, he still has a penis. Doesn't change.
Sounds
you
like
don't just-
sounds like he needs to go to guyology.
Yeah, this
Yeah.
is the one that just turned 9. It just,
Yeah.
you know what I mean? And Bill's like up front dying, like just like can't handle it. And I looked at him and was like, you just got to answer it. If you
Right.
don't answer it, you make it worse.
Yeah.
Yeah.
And then they're going to ask other people. Like, I
Yeah,
would
you
much
don't
rather-
want them
yeah.
asking other people those
Exactly.
questions.
Yeah.
Right.
Yeah.
Yeah. But I was like, no, it doesn't happen like that. They still.
Yeah.
Yep.
Yeah.
Yeah, I'm not really prepared for this. I wasn't
Yeah.
prepared for Braden to be like, where did I come out of? I was like,
Yeah.
I'm scared.
So endometriosis, did we cover everything that you wanted to?
Yeah, I mean,
And it is very common.
Yeah.
There's lots of treatment options for endometriosis. We're developing several new drugs right now. Unfortunately, they're very good, so that's great. But unfortunately, right now we have a very limited amount of time that we can use them. So we're trying to figure out how to be able to use these drugs for a longer period
so
of
are
time.
they like hormonal?
Yeah, not
Mhm.
in the way that you think of as like a birth control is
control.
hormonal, but Orlissa is the big new drug on the market for endometriosis, and it works very well. It
And is that available?
yeah,
Okay.
yeah, it is, and it's a great drug. But the problem is, depending on if you're using the low or high dose, you can only use it for 6 months to 2 years right now.
Okay.
So a lot of women with endometriosis, they may find great relief from something like an IUD, which tends to be really good at treating heavy bleeding and pain.
Mine did the opposite with that.
And it can. About 75% of IUD users love the IUD.
Mm-hmm.
I would say it's one of those. It's like it's you either love it or you hate it.
Yeah.
75% love it, 25% hate it.
But there's so many options now.
There's so many
I think that's
options.
the great part. Like,
Yeah.
you know, when I had my third, and it was C-section, I thought everything went fine. And afterwards, he was like, that was a mess in there. He's like, if you ever have to have another like uterine surgery, you need to get Heb up there. Just everything is adhesed in there. Everything is all stuck together. It was a hot mess. And I was like, you kept poker face. Like, cause I had no idea that he was like, yeah, I had to go in and out and over and around. He's like,
Yeah.
good thing you weren't trying to get your tubes tied because we couldn't have gotten to him anyway. And I was just
Wow.
like, oh, that's good to know.
Yeah.
I actually did a C-section like that this morning.
Okay, see?
Yeah. Yeah.
I don't know why that's like, whoa.
Yeah, it's all like stuck together.
And then he just comes here.
Yeah.
Yeah.
I actually ran out of the OR. Ran out of the OR, jumped in the shower because I smelled horrible, and then ran
Thank
here.
you for sharing.
Thank you. But you guys are amazing. Like what you're able, you know.
Yeah.
Yeah.
I think one of the qualities of a good OB-GYN is being able to stay calm under pressure.
You were real calm when I was hemorrhaging.
You have to be inversely, you have to be inverse to the drama.
Yeah.
Because when it's people's baby and when it's somebody's mom or wife,
Mm-hmm.
there tends to be a lot of drama
Mm-hmm.
with like how the patient and their family members feel, and you know it can feel life or death a lot of times, and it doesn't do any good to lose your cool in those
Mhm.
moments.
Right.
And you're dealing with a patient who's awake.
Oh,
You know,
almost always.
Exactly.
Yeah.
Versus other surgeons, it's like there's a problem, knock them out. We're going to go in there and fix what we need to fix in a nice, calm, play our music, have our, you know. Whereas they're awake and they are communicating with you. Like,
Yes.
I would imagine that just adds such a layer of complexity to handling a difficult medical problem, like what happened with you, and same with me. Like I had no idea. I had no idea what was going, on beyond the curtain. I thought everything was A+.
Right. Yeah.
Yeah, you were freakishly calm. I'll never forget it. But then the next morning you came in, you were like, holy shit.
That was bad.
Yeah.
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 Yeah. Yeah. You never want somebody to feel more upset than they have to
Yeah.
Mhm.
in an emergency.
Right.
So
That takes a special doctor. It really
yeah,
does.
I think you have to be a special doctor to be an OB-GYN because you're choosing a field that requires a lot of you and requires a lot of your family.
Mhm.
And I tell medical students who are thinking about being an OB-GYN, it's like, only do this if this is the only thing you can do. Because you're going to get woken up at 2 a.m. the rest of your life, and you better be okay with that.
Right.
Did you know you wanted to go into OB-GYN when you went to med school?
It's the only thing I knew I didn't want to do. Yeah.
That's so funny.
Yeah. I thought I wanted to be a pediatrician.
Yeah.
And I really loved my OB-GYN rotation. I never felt like it was work. It felt like just like this cool secret that I got to be a part of, that like
Mhm.
people birth all day long, and
Yeah.
like I got to be there for it. And then I loved taking care of women. I mean, women are just so much more interesting than men.
Stop.
I think in a lot of ways. And, men, you can't even like lasso them into the doctor if they have cancer. But especially in OB-GYN, a lot of women are willing to make major lifestyle changes for the health of their babies.
Mhm.
It was also the only field of medicine where you're going to the doctor for a good thing.
Yes.
That's true.
So
And
true.
people tend to be very happy
Mhm.
at their OB appointments, not at their GYN appointments. I am
Correct.
both the favorite
Correct.
and least favorite doctor in the
Yeah.
same day.
Yeah.
But yeah, I really realized that I needed to do something surgical. I liked that. I liked the intensity of it. I liked, my favorite thing about it was getting to hand somebody their firstborn child. That was just like, the fact that doctors get to do this is insane.
The fact that
the
it's
biggest
just
moment of
happens.
your whole life.
Yeah,
Yeah.
just you create humans. It's
Yeah.
just, yeah.
Yeah, it feels like a moment I should not be invited to. So,
But we're happy.
but
you're
we're there. But we're
Yeah,
there.
we're glad we're not
Yeah.
doing it in caves by ourselves anymore. Like, appreciate
Exactly.
you.
Exactly. Yeah,
Yeah.
for sure.
Well, thank you so much for coming.
Yeah,
This was great.
absolutely.
Yes.
Yeah.
I knew this conversation would be real easy with you.
Good. Good.
Yes. So if anyone is looking for an OB,
Yep.
Parkside,
Parkside OB-GYN.
OB-GYN.
Yeah.
Do we want to ask the closing question?
you ask.
Okay, I'll ask the same one we did the previous. We're trying
Okay.
out different closing questions
Okay.
now.
This is new.
Yeah, this is new. So we're trying. You two are
Yeah.
first guinea pigs. So I'll ask the same one. If you had a theme song that played every time you walked in the door, what would it be?
Oh man. Wow, that's a great question.
I wouldn't have been able to answer. I was sitting here like, is she going to ask me that?
What's that song by Usher?
I love that. It's
Peace
Usher.
up, A-Town down. What's that? I'm so embarrassed I don't know the name.
Yeah?
Yeah. There you go.
Literally,
That's what I would want it to be.
Yeah.
That's what I
great.
wanted to be. Yeah.
We're gonna have to start inserting songs.
I know.
Inserting songs.
Yeah.
I know. Our last one said Yin Yang Twins.
Wow. Wow.
It was great. I was like, that.
I love how we're all going down that way.
I recently,
Yin Yang
ran
Twins.
through like a lot of songs in my head all at once, but I think I'd want a hype song
Yeah.
for sure.
Yeah.
You burst in to deliver
Yeah.
babies.
Yeah. Yeah.
Oh my gosh. Well, thank you again.
Yeah,
for
it was
coming.
great. Thanks for having
Yeah.
me. I appreciate it.
We want to thank you all for watching and thank our sponsors. We want to thank Wilson Associates Real Estate, Pearl Dental, Parham Smith Archenhold, Blackacre, and Andy Pfaffl with Network Funding. So
Yep.
thank you so much for your support, and we look forward to seeing you next time.